Hi, my name is Tori Cruz. I am a second-year master's student at Texas Lutheran University, and today I'll be discussing exercise-induced asthma. So exercise-induced asthma is asthma that is triggered by exercise. And what happens during these attacks is that the airways in the lungs constrict and the irritation can cause some inflammation. So what we want to do when we're treating exercise-induced asthma is we want to open up the airways in the lungs and control that inflammation. We'd also like to try to induce what is known as a refractory period, and this involves taking the medications prior to exercise to prevent further exacerbations. The two main medications given here is the beta-2 agonist and the glucocorticoid tablet. The beta-2 agonist is a short-acting bronchodilator, such as albuterol, that can be administered through a metered dose inhaler. So the beta agonist has a quick onset to treat the present attack, and it can also prevent further exacerbations as exercise continues. The beta-2 agonist relaxes a smooth muscle in the airways and causes those airways to open up and dilate. You'd also want to use the meter dose inhaler with the spacer, and the spacer is a chamber that attaches directly to the inhaler, and it effectively mixes the solution with the air for optimal delivery to the lungs. The oral glucocorticoid is a tablet that's administered orally, such as dexamethasone. And what this does is that it inhibits those inflammatory mediators that trigger inflammation in the airways. The refractory period is that period following exacerbation where there are no symptoms, and there are a few steps to take when trying to induce this refractory period. First, you want to warm up to try to trigger those symptoms close to that symptom threshold. Then you'd want to take the inhaler followed by the glucocorticoid. Then you can wait a few minutes and then return to play. And then returning to play, you should have little to no symptoms for up to 1 to 2 hours. The refractory period may not be consistent. Even in individuals with exercise-induced asthma, it may not even be present. So therefore, before relying on it and incorporating it into your plan of action, you want to first experiment with it extensively to make sure that it is first of all effective and that it's even present. There are a few unwanted reactions and precautions that you'd want to take with both the beta-2 agonist and the oral glucocorticoid. The beta-2 agonist stimulates that sympathetic nervous system, which is the flight or fight response. So what it does is it increases your alertness, increases your heart rate, dilates your pupils. So what the beta-2 agonist does is that it can cause nervousness, restlessness, trembling, and then some other adverse effects is it can cause throat irritation and potential airway hypersensitivity. The oral glucocorticoid has both short and long-term adverse effects that could potentially happen. With short-term, there may be an increased appetite, increased fluid retention, and insomnia. With long-term, some things that could be associated with it is osteoporosis, glaucoma, and a decreased muscle mass. So these are just some things to kind of look out for and monitor. Therefore, if they are present, if you do start to notice some of these reactions, you can alert your physician immediately and discuss some alternative methods. Thank you.